Hi everyone, my name is Dr. Nikhil. I'm currently working as an attendant consultant at Nanavati Max Hospital in Mumbai. I was a clinical fellow at University of Toronto from 2021 to 2022. At the outset, I would like to thank Dr. Umesh Khanna sir for giving me this opportunity. A few weeks back, Dr. Khanna called me up and said, would you be interested to do a module on this particular topic? And I told him, yes, I would be, considering I keep on getting a lot of questions regarding my experience at Toronto. People keep asking me questions regarding how did you apply for it? How long was the fellowship? What kind of work profile you did? Is it a paid fellowship? So I thought this would be the best opportunity to compile my thoughts and tell you what I feel and what I experienced during my fellowship. This is a common question amongst all of us, and most of the newly passed out DM or DNB residents are often confused. What should they do next? Should they join a private hospital? Should they join a government hospital, do contribute in academics, complete their bond, or go for an international fellowship? So during my training, my mentors, all of them had trained at some or the other international institutes. It was ingrained in me right from the first day that I need to go out for international fellowship. So what are the advantages of an international fellowship? The experience. Like, what do you mean by the experience? Means the perspective of things when you go for international fellowship. Perspective, I want to say basically it's how you interact with patients over there. What kind of it's a different work experience of working in an atmosphere with which has got lots of evidence-based systems. The complex variety of clinical cases you get to see over there. The patients, how they're much different to our patients in our Indian scenario. The academics is a different entity over there. You also end up interacting with multiple other subspecialties. Overall, this is good for your personal as well as for your professional growth. The pay is pretty good in most of the countries. You also end up doing a lot of extra paid calls. When you go for an international fellowship, you can always travel. You understand the meaning of what is work-life balance. Most of these programs have a 9 to 5 work experience, and you have calls around 4 to 5 calls a month. And there are also research opportunities. There are also some limitations and shortcomings. The application process is very tedious and it is time consuming. You may end up waiting for six months for your visa to come in, or the whole application process from their side. Some people do not have a very good experience in terms of some patient experience, your hospital experience with a poor experience with one of the consultants over there. Sometimes most of us are married at this age and have kids. Sometimes your family, your wife, your children may not get a visa, and you may end up staying away from them for a period of 1 year. This makes it a little difficult for that one period for both your wife and yourself. Many people feel once you come back you will have abundant job opportunities, which is always not so. When you come back, if you're going to be working in a first-tier city, you may not get a lot of job opportunities because you've been out of the country for 2 to 3 years and that place may be occupied by somebody else. And if you're going for an interventional nephrology fellowship, there are very few options at least in Canada, US, UK, and Australia. The Indian programs are better equipped to provide you with a nephrology experience, interventional nephrology experience. So where all can you apply? You can apply to Canada, you can apply to US, UK, Australia, and there are a few ISN interventional nephrology fellowships in Mexico, Malaysia, other countries. This is the most common question which I get asked upon. Do I need to give an exam to go to these countries? And do I need to give an English test? So in Canada, there is no essay. However, and you may not even need to give an English test. You may need to give IELTS or TOEFL in a few clinical fellowships, but you can get away with this. So this is a major advantage of going for a fellowship in Canada, because you don't have to give any exam. USMLE is a must. You cannot go to USA for a clinical fellowship if you do not have USMLE. You again have to give an OET. In UK, you need to have a GMC registration. I'm going to explain again in my later slides how to get a GMC registration. For UK, IELTS or OETS English test is absolutely a must. Australia, the whole process is quite complicated. I'll come to it in my other slides. And there are the ISN fellowships, and the exam depends upon the country of fellowship which you're going to. So this is another question, can we, once we go to these countries, can we settle there permanently? Well, your fellowship does not equate to you getting a consultancy or a job in these countries. It is difficult, but it is not impossible. You may need to do residency, which is including your medicine training as well as the nephrology training. This process is generally quite long, around 5 to 7 years. So that is one thing which you all need to consider if you're going there. Do you want to repeat the whole process again or not? You have to stay longer, to be eligible for a job in these countries. There are, however, always look out for loopholes. There are always some or the other loopholes in all the systems abroad. And you may get, some entry into some program depending upon, your equation with your program director, your references over there, and you always look out for them. So I start off with Canada, how to apply. The Canadian process is, I would say, the easiest. There are a lot of Indian nephrologists, around 50 to 60 of them, who've gone to Canada, especially to Toronto and Ottawa. We basically start off by reaching out to the program director. All the program directors are very accessible by email, and you can expect a reply within 48 to 72 hours. The basic requirements or application for your fellowship are your resume, your statement of purpose. Why do you want to go there? They need 3 reference letters from your mentors in India, which are usually supposed to be sent directly to them, your nephrology degree, and your English proficiency test. Like when I had applied to Toronto, they did not need an English proficiency test. I was eligible based on my 12th standard mark sheet, which did include that I have a proficiency in English. So that is the advantage of at least Toronto and Ottawa, where they do consider your English proficiency based on your HSC mark sheet. Once you send in these requirements, they will conduct a video interview. Once you are selected, they will notify you within a span of 1 to 2 months. So once you get selected, there are 3 main processes which you need to complete. One is the postgraduate medical education process, which someone from the university will help you, will get in touch with you and help you guide through the whole process. This basically involves your vaccination, completing certain online modules, your other requirements. The licensing body requirement, for example, if you're going to Toronto or Ottawa, the licensing body is College of Physicians and Surgeons, Ontario. These do have a lot of requirements, so you have to start in early. You need a good standing certificate from your licensing body in India. You need to send in your medical transcripts, which are basically your undergraduate degree, your MBBS degree, which needs to be shown over there, which needs to be verified, and some police verification and a few other documents, but they guide you through this process, so it happens. The last is your visa. Entire process takes time, hence you need to apply at least 6 months to 1 year in advance. Which city do I apply to, and how do I reach out to the program directors? So, Toronto, Ottawa, Vancouver, and Calgary, Edmonton are the major cities in Canada. I've included the links of these sites. You can I can request Kanasa to share this presentation with you, and you can directly click on these links and you'll be directed to the pages of these particular universities. And on the university, you can get the email IDs of these program directors and you can reach out to them. So which fellowship should I apply to? This is another question, people ask me, did you go for a transplant fellowship? Well, Toronto is little strict about their policy. They require you to do your general nephrology fellowship for a period of 2 years. So this is needed. You cannot get a subspecialty fellowship without doing the general nephrology fellowship, which is for 2 years. Once you complete your around 1.5 years of your training, the program director will probably reach out to you and ask you, are you interested to stay here for 1 more year? And if yes, they will direct you which fellowship programs can you apply for. The transplant fellowship is a highly competitive fellowship at University of Toronto. It's a 1-year fellowship. It's a FAST accredited fellowship. So once you complete your general nephrology, you can reach out to the program director of transplant fellowship, tell him you're interested, and he can probably guide you. Onconephrology is a very upcoming fellowship at University of Toronto. Very good. You work with people from Princess Margaret, so that itself is a good fellowship. The home dialysis fellowship, which basically involves home hemodialysis and peritoneal dialysis. Care fellowship is a cardiac and endovascular, cardiac and endocrinology fellowship, along with nephrology, which also is for a period of 6 months to 1 year. They have newly started a POCUS fellowship at 1 year at Sunnybrook Hospital. They have a critical care fellowship and a glomerular disease. Glomerular disease fellowship is a highly competitive fellowship, so you may or may not get it. Ottawa has a general nephrology fellowship for 1 year, which is, I think, so a big advantage, considering you can, do 1 year of general nephrology and move to a, subspecialty fellowship after 1 year. Sometimes, if you are lucky enough, and if a position is available, you may get directly a transplant fellowship, a GN fellowship, a critical care, or a hypertension fellowship. Vancouver predominantly has a transplant nephrology fellowship, a GN fellowship, and a home dialysis fellowship. Vancouver fellowship is a highly competitive fellowship because many people from Australia and New Zealand will be applying for this particular fellowship, as they do have some collaboration with those countries. And you will need an IELTS for Vancouver. Calgary and Edmonton just have a transplant fellowship. You can always give a try over there as well if you're interested only in transplant. The life during fellowship, you won't be getting any hostels. You have to rent out your own apartment. The Canadian universities pay pretty well, around 5,000 to 5,500 Canadian dollars. Your average monthly expenditure, including your houses, comes up to around $2,500 to $3,000 a month. So if you're judicious in your spending, you will end up saving quite a bit of money. You also get to do extra paid calls once you're set in the system, and these extra paid calls they pay you very well. You end up doing 1 or 2 weekend calls a month. You do get a lot of holidays, and you're entitled up to 20 days of paid leave. During the fellowship, you get it rotated in different blocks. You will be doing a few months of inpatient service, a few months outpatient, a few months of hemodialysis block. So that's how the program is divided. The University of Toronto fellowship is divided into 3 hospitals. You'll be rotated at Toronto General, which is one of the best hospitals in the world. You will be working at Sunnybrook Hospital. You'll be working at St. Mike's Hospital. So these programs, every center has a different experience. Even in Ottawa, you work at 3 centers. You don't get any interventional procedures at these, at least in the Canadian programs, because these are predominantly interventional radiology guided branches. So you won't get them. You will only get a temp line. You can always discuss with your program director or mentor what are what is your scope over there, and what are your interests. So they can always guide you according to which fellowship program you would like to go. So UK, your General Medical Council registration is a must. IELTS or a OAT is a must. Without these two, you cannot go to UK for an international fellowship. Having a subspecialty or a ESE nephro qualification does not entitle you to for a GMC registration. You can look out for jobs like a renal registrar or a clinical fellow on jobs.nhs.uk or track jobs. You can also reach out to friends or colleagues working at different NHS trusts to tell you if there are any jobs available there. If your previous colleagues have gone there, they can always guide you regarding getting a job at a particular trust. So GMC registration can be acquired by 3 steps. The PLAB, it's just a licensing exam. It is not a degree. Step 1, you have to give it in India. Step 2, you have to go to UK to give it. MRCB is a degree. It's a 3-step process. MRCB 1 and 2 and PACES. The 3rd step PACES is an OSCE examination. You will require around 1.5 years to give these exams, and then only you can go. And third, and a very lucrative option, is a medical training initiative project. It's started by the government to basically attract postgraduate nephrology fellows or other branch residents to come there for a UK experience. It is neither a degree nor a licensing exam. Royal College will sponsor your GMC registration, but you can be there only for a maximum duration of 2 years. If you are lucky enough, you may get a locum consultant job at the end of this thing. However, you need to come back, change your visa, and then go back again. Locum consultant is not a long-term position. It is given for a short period of time. You can be there for 2 to 3 years, depending upon the availability of the job. What are the requirements for medical training initiative? This too requires an IELTS or a OETS. Your primary medical degree again needs to be verified by your ECFMG. Just note that none of the foreign universities do consider your nephrology or your training as, I would say, as a primary medical degree. MBBS still holds the most important step. Uh, you will need MRCP 1 or your postgraduate medical qualification. You need 3 years of experience, which generally includes your MD or super specialty training. And you must be in active clinical practice for at least last 12 months or 3 out of last 5 years. How to find jobs via MTI? You can go to the Royal College of Physicians site and click on this link, and there is a big pathway which shows how you can apply to them. You can again go on jobs on nhs.uk. You can reach out to individual trusts, email them if they would consider your application via MTM. Reach out to program directors via social media platforms. You contact your friends working in UK, and you can reach out to organizations like BAPIO, which hold interviews in major cities in India like Mumbai or Delhi. USA. The USMLE again is a must. You may get a research fellowship without doing MLE. You apply to individual programs, like reach out to program directors on Twitter or other social media. After doing a fellowship, there is a possibility of restricted license at a very few institutes. That means after working in a particular institute for 4 to 5 years, they will give you probably a restricted license. Going to USA is a difficult process. Even after MLE, you really need good references for a good fellowship program in the US. Another option which many fellows have met during my fellowship from Middle East, they should come to Canada, prepare for MLE during a fellowship, and then from Canada go to USA. You also get the advantage of getting references from the consultants in the big Canadian hospitals, which definitely counts a lot when you're applying for a fellowship in USA. The Australian process is, I would say, the most complicated process. It has got very limited nephrology fellowships, dedicated nephrology fellowships. My suggestion would be to reach out to Indian nephrologists who have migrated to Australia, and most of them are from CMC Vellore, and probably they can guide you how you can go to Australia. They have a different pathways. One of them is the competency pathway, the standard pathway, which involves giving the Australian medical exam 1 and 2, or the competency pathway where you send in your documents, they will assess how competent you are, and based on that decide whether you can come there or not. Another option is to look out for jobs on this particular website, seek.com.au, and you can reach out to individual provincial sites like Victoria or New South Wales and look out for renal jobs. Mail them, see if we can consider you for an interview, and they can give you a restricted license for a period of 1 year. Coming to the last part, ISN fellowships. The ISN fellowships are generally for a period of 6 months to 12 months. Go on. I've included this particular link. You can click on it, and on that they have given you an entire guideline, what all documents you need, whether you how to apply for this process, and how to reach out to the host institutions, what all documents it will guide you in detail. It also includes fellowship centers, your application process in detail. So this may be an observational fellowship or hands-on fellowship. There are a few caveats in this process. Like, for example, if you're applying to US or Canada, again, probably you may need an MLE. If you're going to UK, you will still need a GMC, and it's same for Australia and South Africa. You will need a letter from your host institution saying that you would, that come back and work in the institution after completion or training, and you have to come back after 3 months. And you have to keep sending progress reports every 3 years after you come back to your home institute in India. And failure to do so can result, the violation of their condition of the fellowship, and you may need to pay back the grant money back to ISN. These are some of the limitations, I would say, of the ISN fellowship. Thanks to Kanasa, who did put up this thing on the Young Nephrons group. Their ISN has started with interventional nephrology fellowships. There are 11 centers, including AIMS. These are generally for a period of 3 to 6 months. This is again a link of the guideline booklet available on their site, which tells you how to apply for these fellowships. However, if you ask me, like most of the Indian DM and DMB programs give you a really good intervention exposure. So personally, I would probably not go for an interventional nephrology fellowship outside and try for the other programs over there, as you get enough interventional exposure in India. And in conclusion, I would say start early. Think about it during the first year of nephrology training, whether you would like to go out or not. Keep your long-term goals clear. You should be clear whether you want to go there, settle there, or you want to come back. To discuss it with your spouse, whether he or she would like to come along with you, what would they do if they don't get a job there or there. International fellowship definitely have advantages, as I said earlier, professionally and personally, but they have their own caveats. Job prospects after coming back home may or may not be great. And if you have any other questions, you can reach out to me on my email. I'll be happy to help you all. And I would like to thank my alma mater, Sunnybrook Hospital, Toronto General Hospital, and St. Mike's for giving me such a great opportunity to learn at these wonderful institutes. Thank you.